Hello, students. It's nice to see you. I'm your teacher Roxy, and I'm glad that you're here. If you are new to this channel, please do like, subscribe, and share this video lesson, and also hit the bell button for you to notify with my new video lessons to come. Today, we will talk about the newborn screening, Apgar, breastfeeding, and immunization. Are you ready to listen? Let's do it. A new baby at home is exciting, but it can be scary too. Newborns have many needs, like frequent feedings and diaper change. Babies can have health issues that are different from older children and adults.
The first time a mother embraces her baby is a time of immense happiness. In the Western Pacific region, one newborn dies every 2 minutes. Newborn deaths largely occur due to inappropriate clinical practices at the time of birth and during the first few days of life. But we can prevent these newborn deaths through a very simple solution: early, essential newborn care. A set of simple, cost-effective interventions that benefit all newborns.
Essential newborn care. Protocol, aimed to significantly reduce infant deaths in the country. Protocol can pave the way to reduction of neonatal deaths. Essential newborn care is a comprehensive strategy to improve the health of the newborn, through interventions before conception, during pregnancy, soon after birth, and in the postnatal period. This protocol will focus on the first few hours of life of the newborn, with the manual guiding the health workers and medical practitioners in providing evidence-based essential newborn care. The guidelines are categorized into the time-bound and non-time-bound, plus unnecessary procedures. Time-bound procedures should be routinely performed first, which are: Number 1, immediate drying. 2, skin-to-skin contact. 3, clamping of the cord after 1 to 3 minutes. 4, non-separation of the newborn from the mother. And 5, breastfeeding initiation. Non-time-bound interventions include: 1, immunizations. 2, eye care. 3, vitamin K administration. 4, weaning. 5, washing. 6, routine suctioning. 7, routine separation of newborn of observation. And 8, administration of pre-lacteals like glucose, water, or formula. Newborn screening. After childbirth, in the first 2 or 3 days of life, a test for the newborn shall be done to detect possible harmful or deadly disorders. This procedure is known as the newborn screening. It is done by getting a small blood sample for the baby's heel for testing. Genetic or inherited disorders may also be detected enough through newborn screening. These may affect the baby's normal development physically and mentally. Newborn screening allows the parents to know certain conditions of their baby that may eventually cause problems. Early detection and diagnosis prepared the parents for the proper care and attention they should give to their baby. Newborn babies should undergo a newborn screening as reflected in RA number 9288. Republic Act number 9288. An act promulgating a comprehensive policy and a national system for ensuring newborn screening. Newborn means a child from the time complete delivery to 30 days old. Newborn screening, or NBS, is a simple procedure to find out if the baby has a congenital metabolic disorder that may lead to mental retardation, or even death if left untreated. Importance of newborn screening. Most babies with metabolic disorders look normal at birth. By doing NBS, metabolic disorders may be detected even before clinical signs and symptoms are present. And as a result of this, treatment can be given early to prevent consequences of untreated conditions. When is screening done? Newborn screening is ideally done on the 48th to 72nd hour of life. However, it may also be done after 24 hours from birth. How is newborn screening done? A few drops of blood are taken from the baby's heel, blotted on a special absorbent filter card, and then sent to a newborn screening center, or NSC. Who will collect the sample for newborn screening? The blood sample for NBS may be collected by any of the following: physician, nurse, medical technologist, or trained midwife. Where is newborn screening available? Newborn screening is available in hospitals, lying-ins, rural health centers, and some private clinics. If babies are delivered at home, babies may be brought to the nearest institution offering newborn screening. What should be done when a baby is tested positive in the NBS? Babies with positive results must be referred at once to a specialist for confirmatory testing and further management. Should there be no specialist in the area, the NBS Secretarial Office will assist its attending physician. When are newborn screening results available? Results can be claimed from the health facility where NBS was done. Normal NBS results are available by 7 to 14 working days from the time samples are received at the NSC. Positive NBS results are delayed to the parents immediately by the health facility. Ensure that the address and phone number provided to the health facility are correct. A negative screen means that the NBS result is normal. A positive screen means that the newborn must be brought back to his or her health practitioner for further testing. What are the disorders tested for newborn screening? The disorders tested for newborn screening are congenital hypothyroidism, congenital adrenal hyperplasia, galactosemia, phenylketonuria, and glucose 6-phosphate dehydrogenase deficiency. Now let us talk about the behavioral development of a healthy baby. For 0 to 1 month, suckles and smiles. For 2 to 3 months, vocalizes and controls head. For 4 to 5 months, controls hands and rolls over. For 6 to 7 months, sits briefly and crawls. For 8 to 9 months, grasps and pulls up. And for 10 to 11 months, walks with support and stands alone. Why is Apgar scoring system important? Its name came from its developer in 1952, Virginia Opkar, but later became an acronym which means appearance, pulse, grimace, activity, and respiration. The baby shall be scored twice, using the Apgar test at 1 minute after birth, and at 5 minutes after birth. And if it is needed, the baby shall be scored for the third time at 10 minutes after birth. Medical personnel like doctors, midwives, or nurses give their score by combining all the 5 factors which may range for 0 to 10. The score of 10 is not commonly obtained. This is an example of Apgar scoring system from event medicine. You will see here the score from 0, 1, and 2, and also the acronym of Apgar, the appearance, pulse, grimace, activity and respiration. Why is immunization important in protecting children's health? While babies get antibodies from the placenta while they were growing and developing in their mother's womb, and from their mother's milk through breastfeeding, they were just temporary. As the baby grows up, he or she needs continued protection from infections and diseases. This is done through immunization or vaccination. Immunization makes the child become immune or protected to diseases by getting small dosage of killed or weakened microorganisms, bacteria, or viruses that bring about a particular diseases. Vaccines are injected and stimulate the immune system of the child. Now, let us talk about the Rooming In and Breastfeeding Act of 1992, or the Republic Act No. 7600. The estate adopts rooming in as a national policy to encourage, protect, and support the practice of breastfeeding. It shall create an environment where the basic physical, emotional, and psychological needs of mothers and infants are fulfilled through the practice of rooming in and breastfeeding. Breast milk is the best food, since it contains essential nutrients suitable for the infant's needs. It is also nature's first immunization, enabling the infant to fight potentially serious infections. It contains growth factors that enhance the maturity of an infant's organ system. Lactation. It is the period of milk production, initiated by the prolactin hormone in the mammary glands. The mother's milk is bluish and watery. It has approximately 67 kcal, or 100 milliliters, or 20 kcal per ounce, and 1.2 grams protein per 100 milliliters. An average of 850 milliliters of mother's milk is produced every day. The first thick yellowish fluid that comes out from 2nd to the 5th day after delivery is called colostrum. It should be given to all newborns, because of its high protein contents. Healthy childcare entails breastfeeding of the baby. Remember, newborn screening can detect metabolic disorder, hormonal, and blood disorders. These disorders may affect the use of nutrients in the baby's body, and may prevent having healthy tissues as well as the production of enough energy. Newborn screening is available in hospitals, lying-ins, rural health centers, and some private clinics. If babies are delivered at home, babies may be brought to the nearest institution offering newborn screening. After the baby's birth, a quick evaluation of the newborn's physical condition is done. It is the very first test of the newborn known as the Apgar score. It can tell if the newborn needs extra medical or emergency care. As the baby grows up, he or she needs continued protection from infections and diseases. This is done through immunization or vaccination. Immunization makes the child become immune or protected to diseases by getting small dosage of killed or weakened microorganisms, bacteria, or viruses that bring about a particular diseases. Vaccines are injected and stimulate the immune system of the child. Breastfeeding is the traditional and ideal form of infant feeding. Meeting an infant's nutritional needs for his first 4-6 months of life. Human milk is clean. It lowers the risk of intestinal illness and general infection. Mother's milk provides a host of protective factors, both cellular and hormonal. Breast milk contains antibodies that help the immune system of the infant strong. It is non-allergenic and easily digested. And that is all for today. I hope you learned something new about our topic in Health 8. We'll see you again on the next topic. Thank you and keep learning. Goodbye.